So what I'm doing now is just wiping away the white marks on the skin, and then I'm going to just use some hydrating product which will actually help her feel that it's calmer. The skin will be calmer. So this is a Obagi SPF 50 that I'm going to actually put on her today, and this is a product which will give a really good cover protection, and I'm going to pat it on, and so you can still see the sunblock, and within that time it's going to be able to sink into the skin. Okay, so this redness will last probably until tomorrow, so maximum 24 hours. It looks as if she's had a good workout in the gym, as I said to her before. It does feel warm, but we've put a lot of energy in there, so that's normal. And when you actually do the treatment, the pores that you're trying to refine, because of the inflammation that you're putting in, sometimes they look a little larger. So the patient shouldn't actually worry, because once that inflammation has calmed down, then that's when the pores start to shrink.
So during the treatment, it felt really comfortable. I had the numbing cream on, so that took the edge off of it. It just felt slightly warm in places, mainly the lips and the closer to the eye she was. But apart from that, it was really tolerable. I feel slightly warm and a little bit like I've just been in the sun for too long. So the consultation really helped me during the treatment because I knew what would be happening, and she went over that as we were having the treatment as well, so I obviously could remember, and I wasn't surprised by anything that was happening. So my practitioner was very methodical in how she treated my face, so I wasn't surprised by the treatment because it's a bit off-putting when you can't see, and I felt like she wasn't jumping all around my face. It was very ordered, so I could kind of see what was coming next, and it wasn't a surprise to me. So at the moment I'll be going through the recovery phase, which can take up to 7 days, at which point I'll then see my practitioner, and they'll check my progress and we'll decide where to go from there.
So what Clear and Brilliant offers is 2 potential wavelengths that you can actually offer your patient. The first is 1927, which is working superficial in the skin. It creates little wells where you can actually utilize to fill up the skin with good products. So you can actually get better permeability of those products, and the patient's skin will be healthier as a result of that. The second wavelength, which we used today, was 1440, and this is going deeper into the living part of the skin, the dermis. It's going to stimulate collagen because of the heat that we create, and as a result of that, you're going to get a skin that looks brighter, fresher, and also those pores are going to be refined. It is the gold standard for pore refining in the industry, and really a very, very simple device to actually use. Patients would typically use several products following treatment, and so this will aid with recovery, but also get them into a good regime. And so hydration is always important. There are several hydrating products on the market. Today I use the Obagi Hydrate. We would also use vitamin C on certain skin types that aren't oily. This also helps to take down the redness following treatment. And of course, today we use an SPF 50, which was from Obagi. This is a zinc product which actually will help to reflect the sun and give the patient total protection.